Welcome to Malawi's presentation on institutionalizing experience of care measurement in Malawi. I am Lucy Chigwenembe, the Chief Quality Management Officer for Southwest Quality Management Office under the Ministry of Health in Malawi. The outline of my presentation, I'll give you the background of how Malawi is in the quality of care network. Also, I'll give you the background of our measurements. We are using the Hospital Ombudsman platform. And then I'll talk about the experience of care and then the exit interviews, which the Hospital Ombudsman conduct on a monthly basis to measure the experience of care from our clients. And also I'll talk about the reporting system and then the lessons that we have learned with this initiative. On background, Malawi joined the MNH QC network in 2017. It is a global network coordinated by WHO to reduce maternal and neonatal deaths by 50% by 2022. So Malawi joined in 2017. Other countries in the network, Ethiopia, Ghana, Kenya, Tanzania, Nigeria, Sierra Leone, Uganda, just to mention a few. And then Malawi is using the MNH as a learning platform for implementing quality improvement program at a larger scale. So Malawi adopted the WHO MNH standards to Malawi context around the LALA framework, that's the leadership, action, learning, and accountability. So on accountability avenue, we are getting feedback from the clients using the Hospital Ombudsman platform and also annual client satisfaction survey. We did this because we wanted to get feedback from the clients, but also to make sure that we are really using the clients' feedback to improve the quality of care. So the Hospital Ombudsman platform is a grievance redress mechanism whereby we want to involve our clients in their care. We want to get their feedback and then use that to improve the care which they come and get from our facilities during their next visit. So in the platform, we are using the people from administration or from environmental health. We chose these people because they don't provide direct patient care. So we want to have someone who is independent. Of course, to a larger extent, we want to have people who are completely independent, those not employed by the Ministry of Health. But currently, to address this, we are just using the already employed staff. So we try to get those who do not provide direct patient care. So we are using people from administration, like the human resource officers. So the program is being run in collaboration with the National Office of the Ombudsman, who have the mandate over the government departments to make sure that people are not being treated injustice. So on the long term, as I already explained that this position would want to have the permanent positions whereby we have independent people, but currently we are using those positions, the administration and the human resource. The main focus on the Hospital Ombudsman is to get the community feedback. So the platform has a strategy which we developed together with the National Office of the Ombudsman, whereby this strategy guides our implementation. But now to better in on the patient experience measurements, we are using the platform to get feedback from the clients through the exit interviews. So like the Hospital Ombudsman get the information from the walk-in clients. Next slide. From the walk-in clients who come and give their feedback, like if they have complaints, if they are not satisfied maybe with what they have been given at the facility, but also from the Hospital Advisory Committee. In all our facilities, they have the Hospital Advisory Committee. Now we call them Hospital Health Center Management Committee, whereby we have members from the communities, but also the facility management. But also the Hospital Ombudsman, they get feedback from the suggestion boxes, whereby clients are encouraged to put in their suggestions in the in the boxes, but also if they cannot come in person to complain to the hospital ombudsman, they put some of their complaints in the suggestion boxes. But also the hospital ombudsman are encouraged to have their phone on 24 hours. So some complaints, they come to the hospital ombudsman through phone calls. And also the hospital ombudsman is encouraged to be proactive. So they go around the facilities to do inspections to make sure that if there are issues, they have to collect them before the clients come and complain. But also, as I've already indicated, they conduct exit interviews. So on a minimum, each and every hospital ombudsman is supposed to conduct not less than 25 exit interviews. So those exit interviews plus the other avenues where they collect information, they analyze them and then have information on a monthly basis whereby we base our interventions. On exit interviews, on experience of care, as I've already indicated, that we have the hospital ombudsman who routinely collect feedback from the clients on monthly basis through the exit interviews, but also we get the experience of care from our clients through the periodic annual surveys. It is our wish to be conducting annual surveys in each and every facility in Malawi so that we complement the information that we get from the hospital ombudsman on monthly basis. So for the routine care from the hospital ombudsman, as I've already indicated, they conduct on a minimum 25 exit interviews using a checklist, which is in local language. So this checklist, of course, the one page they can use for 5 clients. So they get the consent from the clients. The main issues or the main questions which are asked on this client feedback questionnaire, which they use for the exit interviews, they check on the waiting time. They ask the clients how long they waited from the time they arrived at the facility to the time they get assistance from the health providers. But also we get information if the clients were involved in decision making, if the treatment was explained to them. But also we ask about visual and audio privacy, but also want to get information from the clients on the cleanliness of the facilities. But also we ask about informal payments. The health system in Malawi, like for the government facilities, clients are supposed to get the services at free. So you find that some people, they would want to jump the queues. So there's those informal payments. So we also ask on that information. And then for our postnatal mothers, we asked about pre-discharge counseling, but also if they had a birth companion of their choice during labor and delivery. But also directly we asked them if they are satisfied with the care which they have received, of course, like in our annual survey questionnaire, but also from this exit interview by the hospital ombudsman. There are questions which at the end of the day, we analyze to say that, okay, one was satisfied or was not satisfied. But apart from that, we'd also want to ask the clients directly if they're satisfied with the services that they have received. And also we ask them if they can recommend the facility to family and friends. So all this information is analyzed and then the information is used for quality improvement. So from those information, the common findings, which we always find are as follows. Of course, on this one, we interviewed some hospital ombudsman from 2 districts, that's Kasungu and Lilongwe, around February. That was after we were hit with COVID-19 in January. So we were getting a lot of complaints. So in February, we tried to visit 2 districts to find like how the hospital ombudsman functioning on the ground. So we went to these 2 districts. And then we found that like from October to December, last year, the hospital ombudsman, like 75% of them, they had like 9 complaints. And then 5% had up to 19 complaints. Up to 15% of the hospital ombudsman had up to 30 complaints. And then only 5% had above 30 complaints. So from these complaints, they commonly issues which the clients were complaining were about delay in service provision, like the facilities, they are not adhering to office hours. So that was the major complaint from the facilities. So these complaints, like we were doing the percentage out of the hospital ombudsman who were interviewed, like 22% of the hospital ombudsman indicated that like clients were being asked to pay for money for free services, but also 22% also indicated that clients complained of lack of medical supplies, and only 9% complained of the long waiting time. On this one, like for the antenatal care, women, like some women waited up to 6 hours before being assisted at the facility. So they complained about the long waiting hours, that they have been at the facility for over 6 hours before being seen by a healthcare provider. So these are most the common complaints which we found in our facilities. And then on the reporting system, like when they found these issues, when they have interacted with the clients, the urgent issues are reported to the facility in charge, and also some issues which are maybe they cannot take to the in charge, they are being communicated to all members of staff through the morning meetings. But also on monthly basis, the hospital ombudsman is part of the quality improvement support team. So they analyze their information and present to the quality improvement support team, whereby these issues or the resolutions are being taken and included in the quality improvement plan for the following month to make sure that they are responsive to the client's issues. And then also on monthly basis, the hospital ombudsman reports are entered in the DHIS tool, whereby this is a platform whereby all the health information are entered, and then people can able have that data and then see, and it's also analyzed. The indicators which are in there, they can be analyzed and then seen on the dashboard. So for the complaints, they are managed according to the protocol, or those complaints which are above or beyond the hospital ombudsman, they are referred to relevant authorities. Like those which about professional issues, they are referred to the regulatory bodies. Complaints or issues which are criminal in nature, they are referred to police. But also issues which the hospital ombudsman say that, okay, there was really injustice, those ones they are referred to the National Office of the Ombudsman. So that's how the hospital ombudsman functioning, that they have limitations. So on the monthly reporting form, on monthly basis, they need to report like per facility, not as a district, but per facility. So each facility, when also entering their data, they enter according to department. So the monthly reporting form, like the first part is about the complaints or the issues. So they enter it according to department, whether it's maternity, outpatient department, under 5 department, or general inpatient department. So they indicate the number of cases which they have per each issue. And then after that part, they also indicate on the complaint resolution, whereby if they have resolved all the issues that were brought to their office, or if they have carried forward some other issues that need investigations. And then also in the report, there is also part of user satisfaction, whereby they indicate how many service users they have indicated in that particular month, but also how out of those ones, how many were satisfied with the care which they received. And then for the maternity clients, they also asked if they have received pre-discharge counseling for the mother and also the baby. And also they asked the woman, they also analyzed the data, they also compiled the data for the companionship. So they indicated how many women wanted to have a companion during labor and delivery, and how many were granted that wish. So that data is also indicated in the hospital ombudsman monthly reporting form. And then they also indicate on the referrals where they have referred cases to the office of the ombudsman, to the regulatory bodies, to the appointment and disciplinary committee, to management, to Malawi police and other bodies. And then they also indicated if they have closed the cases. This part would want to know if near the hospital ombudsman, they are resolving the cases according to client satisfactions, or else the clients, they just lack interest. So we want to know how and why the cases they were closed, so they indicate the reasons for closure for the cases. So this data is entered in the DHIS on monthly basis. And then even though we are relying on these hospital ombudsman, there are also some challenges that they are faced by the hospital ombudsman. Of course, 8% of the hospital ombudsman, they indicated that like they have a workload, as I've indicated that we are using people from administration or the human resource officers. So they have their core responsibility, but this one is an added responsibility. So 8% of them, they indicate that like they had a workload challenge. And then also there's minimal utilization of the platform by the clients. And also 12%, the very same 12% with minimal utilization of clients, they indicated that like they were not doing maybe community sensitization due to lack of transportation. So because they don't have transport, they didn't go to the community to sensitize their communities that there's this platform that they can come and then raise their issues. But also 12% of the hospital ombudsman, they also indicated that there was minimal cooperation from some complainants, that the people, they can come and complain, but then the issues needed investigation and then needed follow-ups. But then you find that like during follow-ups, the complainants, they have minimum cooperation, but also they indicated lack of stationery and other tools, of course, like airtime for follow-up. And then also lack of feedback and supervision from the district health office. And also, as I've already indicated, that we are using human resource officers, people from environmental, the administrators. There's also lack of office space because maybe they're sharing office. So to offer privacy to the complainants at times is difficult. But also the major issue which they face is the lack of cooperation by some staff members. Even though the members of staff were oriented or briefed to the platform, but some they are still not happy because they take the platform as maybe they are spying on them, on how they perform their activities. So some they are not happy. So at the end of the day, when there's a complaint and then they are called to come and then maybe to be listened to, you find that there is no cooperation. So these are some of the challenges that are faced by the hospital ombudsman in this platform. And then on the periodic annual surveys, as I've already indicated, that it's our wish to be conducting these periodic annual surveys to complement on the information which is already collected by the hospital ombudsman on monthly basis. Most, of course, it's because of resources, so we rely on partner support. So what happens, like previously, like most of the partners, they were doing the periodic annual surveys to check client satisfaction, but also to get their experiences. So what Malawi did as a country, we harmonized the two. We get all the tools from the partners, but also us as a government, we checked on what is it really matters, and then what are the issues that we want to include in our annual client satisfaction survey tool. But of course, like we agree that, okay, we call it an experience of care so that we can get as much information from the clients. So we harmonized our tool. And then, as I've already indicated, we rely on partner support to conduct on our annual surveys. So recently, as I've already indicated, that in February, we did the survey in 2 districts. So we found the following, or like on satisfaction on care received, that our clients, like on assistance that they get from the pharmacy, only 5% of the clients, they were dissatisfied with the services. That 95% of our clients, they are satisfied with the way they are handled at the pharmacy. And then when you look at the care which is provided in our wards, in our departments, only 7% were dissatisfied. In the radiology department, in the X-ray department, there was no dissatisfaction, but there was a room for improvement, because I think we were checking whether they were indicating if the experience was bad, was okay or good. So the okay one, we felt that, okay, there's a room for improvement, but even though people, they said that it was okay. So I found that like in the radiology department, people, they were comfortable, but still they were that room that we can improve at, so that our clients, they are really, really satisfied. And then how service providers talk to or treated patients or clients, 3% of our clients, they were not satisfied with the way they were talked to by the providers. So we also checked on the satisfaction of the facility environment. We found that most of the times our clients, they are not happy with the toilets. Like 42% of the clients indicated that they are not happy with the sanitation in the toilets. So we still have room for improvement. So as already indicated, we take this information, we include it in our quality improvement plans for the next month, so that we have to make sure that we are responding to our clients' feedback. And then when we look at what is it that we have learned from this platform, we have seen that the Hospital Ombudsman platform and other variable feedback mechanisms can significantly contribute to improved quality of care in the health facilities. Even though, as I've already indicated, that not all service users are utilizing the platform. Of course, this was due to that, like in that catchment population, you find that there's only one facility. So the clients at times are afraid that, okay, if we complain and then when you go to receive care to the very same facility next time, maybe we are not going to be treated well because maybe the providers will have grudges on us. So you find that like some other people, they are still keeping the issues to themselves. They are not forthcoming to complain, but also as I've already indicated, that community sensitization in other facilities, in other catchment population, it wasn't like done extensively, that the people should be aware of the platform. But we have also learned that good working relationship between the HO, facility management, and also the health center management committees is very important to address the complaints, but also to improve the quality of care, because we involve the communities, we get the community issues, but also the facility, we get their views. And then as a hospital ombudsman who is handling this platform is directed on how best they can work around the issues to improve the quality of care. But also we have learned that legal supportive supervision is required to enhance the hospital ombudsman capacity through mentorship and coaching to strengthen their functionality. As you have said, that like this is just an added responsibility. At times they concentrate on their role. So when we are supervising them, we are guiding them and then coaching them on how best they can handle the platform. It was found that maybe that one can work properly. So this one we do also to strengthen that they report on monthly basis in the DHIS, but also they do their monthly analysis to make sure that they are really utilizing this information for improving the quality of care, because we want to involve our clients as much as possible, that we get their feedback and then we use that feedback to improve the quality of care. So I think that's how we are measuring the experience of care in Malawi currently, apart from the annual periodic satisfaction survey. We also use the hospital ombudsman exit interviews, which are done on a monthly basis in almost all our facilities. Thank you so much.